coronavirus pandemic is creating even more anxiety for women who are expecting. Joining us live is Dr. Mina Desai of the Lundquist Institute. Good morning.
Good morning.
So pregnant women and children have not been disproportionately affected at this point. Why is that so surprising, and how likely is this to change?
So right now, we don't know much really because it's a new virus, but the limited information that we have shows that if pregnant women are infected with COVID-19, the virus does not seem to be transmitted to the fetus or the baby. But like I said, and I stressed, this is very limited information from a very few cases from China. And as we learn more about it, this may change. But right now, there's no indication that if a woman is infected with COVID-19, that it has adverse effects on the baby.
And Dr. Desai, what should pregnant women do if they start believing they have symptoms of COVID-19?
So the important thing is to contact your primary care providers. You contact them, let them know that you're pregnant, that you have exhibiting these symptoms, and then follow the guidelines. And also, a pregnant woman should take the precaution just like any general population. Cover their mouth when they're coughing or sneezing, frequent washing of hands, social distancing. All that is very important to prevent spread of the disease and themselves getting infected.
And Dr. Desai, can infections like COVID-19 be especially dangerous for pregnant women?
Right now, the evidence that we have is that they do not have greater susceptibility than the general population. And again, I stress, this is from very limited information that we have from few cases. As we develop, as we get more information, this may change. But right now, there is no greater risk for pregnant women than that compared to the general population.
Well, that's a relief. Is there anything that pregnant women should do as they get ready to go into a hospital because they might be nervous about catching something while they go to deliver their baby?
That is true that during pregnancy, it's a very stressful and emotional experience, and women are getting very anxious that they're going into a hospital where there may be other COVID-19 infected patients there. But they have to remember that the healthcare providers are taking every precautions. That's one of the things. They are limiting people that should be present at the delivery. Some hospitals say that no one should be present. It's to try and protect the mother, the baby, and obviously the healthcare providers in case the pregnant woman is infected with COVID-19. So right now, I would say that the healthcare providers are taking all precautions to keep you and your baby safe.
Thank you so much, Dr. Mina Desai. The good news is they have reversed the decision where women can have their partners with them in the delivery room. That's wonderful news. Thank you so much.